Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Lymphedema. So under lymphedema, let's look at the primary lymphedema. So this includes the congenital lymphedema. Congenital lymphedema, it occurs before the age of 1 year, before 1 year. And next is present at birth. And then it often involves the lower limbs and the genitalia of the face. Typically it is bilateral, and it includes a Milroy. It is a Milroy's disease and it is a familial variant. Next is a lymphedema. Lymphedema, it is a precox. Lymphedema precox, this is the most common type and it occurs between the age of 1 to 35 and it is more common in case of the females. Next is it is usually the lymphedema precox, it is the usually unilateral, and then it is also affecting the calf. So it is a calf as well as a foot. Then is the Meeks disease. The Meeks disease is it is again a familial variant. Then comes the lymphedema tarda. So lymphedema tarda is seen in individuals over 35 years and it is a rare form of the primary lymphedema. Then comes the secondary lymphedema. Secondary lymphedema, it can be caused by the lymphatic obstruction or the destruction. Lymphatic obstruction is mainly due to the filariasis and with the Wucheria bancrofti. So there is a Wucheria bancrofti and this is as the common organism responsible. The lymphatic destruction can result in the lymph node dissection and can often context in malignancy, trauma and the radiotherapy. Trauma as well as in presence of radiotherapy. Now, what are the clinical features? Clinical features is it includes something known as a buffalo hump. So, buffalo hump is what is seen, and this is at the dorsum of the foot. Next is there is a square-shaped toes, the square-shaped toes, and this is due to the footwear, footwear confinement, and also the stemmer sign. It is a stemmer sign where the skin and the dorsum of the foot cannot be punched. The skin or dorsum of foot cannot be pinched. Next, the clinical grading of lymphedema, it includes a subclinical. So what is meant by subclinical? Subclinical means the excess interstitial fluid with no apparent clinical symptoms. So no apparent clinical symptoms. Next is grade 1, grade 2 and grade 3. Grade 1 means there is pitting edema. Grade 1 stands for pitting edema, grade 2 stands for non-pitting edema, grade 3. So what is meant by grade 3? Grade 3 means edema of the irreversible skin change. So edema of irreversible skin change. Now let's look at some complications. So complication is it includes the limb swelling. So there can be limb swelling which can be seen. It is increased or decreased infection. So increase or decrease in infection, that is bacterial fungal cellulitis, and it is increased with the malignancy. So increased with the malignancy and long-standing cases. Now this was about the complications. So we saw the complications. It includes the limb swelling, increased risk of infections, and increased risk of malignancy in long-standing cases. Next is how would you diagnose? So a diagnosis, if you see, it is by there is primarily clinical and investigations are required for the atypical presentation. Then it is severe lymphedema with the complications such as the multifactorial swelling. Multifactorial swelling can be seen. And then there is a lymph angiography can be performed for the further evaluations. Then the definitive diagnostic test for the lymphedema is nothing but the lymphoscintigraphy. The lymphoscintigraphy. And how do you manage the lymphedema? The management of lymphedema is nothing but by the conservative management, and this includes the compression stocking, as well as the limb elevation, the regular checkups, antibiotics for infection, and specialized complex physical therapy. Next is we move on to the surgical treatment. So surgical treatment is not commonly used, but it may consider if there are a severe functional impairment. So there is in case of functional impairment and recurrent lymphangitis or severe pain. Next is surgical options include the reconstructive as well as the excisional operations. To learn and grow daily like this, please do subscribe.